Assalamualaikum everyone, welcome back to my YouTube channel. Today we are talking about the piriform, fossa and the foreign bodies. So, the piriform fossa is situated on the either side and is bounded medially and laterally, as well as important because it is a common site for lodging of sharp ingested bodies such as fish bones. The presence of such a foreign body immediately causes the patient to gag violently. Once the object has become jammed, it is difficult for the patient to remove it without a physician's assistance. Examination of the lower part is inferior constrictor muscle reveal a potential gap between upper oblique and lower horizontal fibers, which is known as pharyngeus. The area is marked by a dimple in the lining. It is believed that the function is to prevent the entry of air, and the pharyngeus fails to relax during swallowing. An internal pharyngeal pressure may rise and the force submucosa of the dimple posteriorly and produce it. Once it has been formed, it may gradually enlarge and fill with food with each meal. Unable to expand posteriorly because of the vertebral column, it turns downward, usually on the left side. The presence of the punch filled with the food causes difficulty in swallowing. Pus arising from the tuberculosis of the upper cervical vertebra is limited in front by the prevertebral layer of the deep fascia. A midline swelling is formed and the bulges forward in the posterior wall of the pharynx. The pus then tracked laterally and downward behind the choroid sheath and to reach the posterior triangle. Here, the fascia, which forms a covering to the muscular floor of the triangle, is weaker and the abscess point behind the sternocleidomastoid. Rarely, the abscess may track downward behind the vertebral fascia to reach the superior and the posterior mediastina. It is important to distinguish this condition from an abscess involving the retropharyngeal lymph nodes. These nodes lie in front of the prevertebral layer of the fascia and behind the fascia, which covers the outer surface of the constrictor muscle, such as an abscess usually point on the posterior pharyngeal wall and, if untreated, rupture into the cavity. Here you can see the sagittal section through the nose, mouth and pharynx, showing the position of the mirror in posterior rhinoscopy, structures seen in the posterior rhinoscopy. If you have any question regarding that, you can ask me in the comment section. Thank you so much. Keep supporting.